I'm so excited because today's guest has something that I think is really special that we all need to know about. She has had a truly inspiring healing journey. After years of chronic pain from horseback riding, the injuries that she received from horseback riding, only temporarily she had some relief from, the traditional treatments. And she was told her only options were to live with the pain or consider surgery, but she knew there had to be another way. And so she decided to make a shift when she came to discover myofascial release. It's a therapy that not only relieved her physical pain, but transformed her understanding of healing on a much deeper level. So I am so glad to have you here. I thank you so much for being on the V.I.B.E podcast. I introduce to all of you Gwen Bernardo. Gwen, thank you so much for being here.
Oh, Linus, thank you so much. It is such a pleasure and an honor to get to share my story with you and your audience.
Absolutely. You and I were chatting right before and about fascial and the fact that, first of all, a lot of people don't even know what fascial is. And let me say, first of all, the V.I.B.E Living podcast is full of listeners who are interested in alternative medicine, holistic living, and finding out information that maybe they couldn't or haven't been exposed to before. So when we talk about the myofascial release, let's first explain to our listeners what fascial is.
So that's a great question. You know, back in school, we learned about the nervous system and the cardiovascular system, and we learned about all the organs and everything, but we didn't learn about our fascia and the fascia system. And really, it's a shame because it is probably the most important system that we have. It is our connective tissue, and it runs from the top of our head all the way to the bottom of our feet. And if you think of it like a spider web, it contains all of us and contains our organs, our blood. Everything is encased in fascia. So it's really, really important to keep it flowing and loose and hydrated. And so I'm super excited about it because not a lot of people are familiar with it and, don't know what to do with it.
I am familiar with the fascia, but I have to say, and we talked about this before we came on, I don't ever recall having a conversation with any of my doctors that started out with, so how's your fascia? Or doctor, how's my fascia? It's just not something that we talk about, which is interesting because it performs such a vital service when it comes to our bodies. So tell us a little bit about your experience and how you came to understand that myofascial release was really the solution to the problems that you had as a result of your injuries.
So I'm going to just tell you a little bit about my main injury. A while back, I was riding and I had a really horrific horseback riding accident where I was thrown from a horse, got a concussion, broke 3 ribs, twisted my ankle, got a huge hematoma. And that sort of sent me on this path of chronic pain, of shoulder pain, of knee pain, of, I had a pretty bad concussion. And I searched for years and years for different relief at different times and was told, everything was coming back on the MRI was fine. Everything was coming back on the CT scan fine. And was told, well, you're going to have to live with this or you're going to get surgery. And surgery didn't really seem appropriate. And it just really wasn't very pleasant to live with, but that was pretty much my only other option. And at the time, I have an equine physical therapy practice where I worked physical therapy on the horses. So I needed some continuing education and came across myofascial release and was really shocked by how effective and how gentle it was on the horses, because my experience with quote unquote myofascial release was the dreaded foam roller from physical therapy and also very deep tissue painful work where sometimes I would get off the table and be bruised. And so when I discovered the John Barnes method of myofascial release and saw what was going on with the horses, I said, I need to try this for myself. And after receiving 6 hours of the treatment, my pain was greatly reduced, but even more shockingly to me, the emotional constipation, let's call it, that I had around this accident was released. And it was so life-changing that when I got back from my treatment, my husband said to me, I don't know what happened to you over those 6 hours, but you're bitching at me less. And I went, oh, I thought I was a delight. I didn't even realize I was bitching at you. And he said, I didn't realize it either, but now that it's stopped, very noticeable. So to me, that was striking in that here, I didn't even realize how much this accident had been impacting my mental health. Because this accident was at this point now 20 something years ago. And I got into myofascial release about 3 or 4 years ago. So for all of that time, I've been carrying this burden and this emotional weight from this accident that was changing how I performed, how I felt, how I was functioning in the world. And after just 6 hours of being able to release parts of my fascia, changed my life. And that's actually what changed my career, because I said, wow, this is too important. People need to know about this. People need to experience this. Because I really believe if everybody feels better, we're just going to be nicer to each other. And we're going
Well,
to.
that's true. Absolutely. It's hard to be nice with anyone, including ourselves, when we are in pain. One of the things that fascinates me about what it is that you do in this genre of work is how important it could be for women in midlife. By 40 and beyond, we've gone through a lot. There's been trauma, there's been hurt, there's been loss. I mean, a plethora of emotions. By the time you get 40 something, you've experienced just about everything. And one of the things that we're probably not as great as we could be, especially in westernized medicine, is learning how to release that trauma so it doesn't set in our bodies, because that's what it does. I read a book, The Body Keeps the Score, which I'm sure you're familiar with. Most of us have read that are in this genre of work. And it really does paint a picture in terms of what goes on in the body. So from your perspective, especially when it comes with in terms of pain, how do emotions become stored in the body in such a way that it begins to manifest pain?
So when we have an insult to our bodies, let's say we're in a car accident or even in a fight with a loved one, we go into that fight or flight. And for whatever reason, we have to check out. And when we do that, our body kind of shuts down a little bit to protect us. And that's what our fascia is supposed to do. But most of us don't move beyond that for any number of reasons. It's inappropriate. It's not the time. Or if you're in a car accident, you don't get a chance to thaw because you have to keep, moving on, or you start to thaw. And let's say it's a serious accident and they wrap you up in a blanket and they don't allow you to thaw from the fight, flight, or freeze. And these are conditions that can cause fascial restrictions. And so when they don't get addressed, it's like, you can have talk therapy and you can talk about it and talk about it and talk about it. And I believe your listeners are a smart, informed bunch of folks that if you could have talked yourself out of your problems, you would have already. And, trauma gets trapped as anxiety. It gets trapped as emotion. It's trapped energy. And until you get that somatic peace and that somatic relief, you won't clear it. You can't. And I love energy work, but unless you're getting a hands-on actual manipulation of your tissues, you're never going to fully release it because it's literally trapped in your tissues.
Now, there are those who will say, well, I've got this covered. I had a trauma. I suffered from anxiety, and I went to a therapist and we talked about it. And I think that's going to help me feel better. But you have some opinions around that piece in terms of how impactful talking about problems may actually be when it comes to their impact on the body. Could you share a little bit of that with us?
Sure. I love talk therapy, and talk therapy has helped me, and you can definitely make great strides with talk therapy. So this is not me saying anything against talk therapy. I just feel like there is a missing component, and you may not realize that you haven't processed the issue. It may show up as a backache that you cannot get rid of, or a shoulder ache, or a tight muscle in your neck. And yes, you've worked through it on the conscious level, but if you haven't worked through it in the body level, you won't be able to release it. And with this work for myself, it's been fascinating because after probably about 50 hours of the work, I remembered a car accident that I had been in as a child, which I had completely forgotten about. And it wasn't until I started processing that I was like, oh my God, I remember this is, you'll see how old I am, being in the station wagon, in the back of the station wagon with no seatbelts and getting thrown into the second seat. How long have I been carrying that? Since I'm 8 years old. I'm 54. You can do the math. And also when I've had people on my table that I've been treating, they've definitely worked through the death of their father, but then I release a hip and all of a sudden memories come flooding back and, emotions come up and challenges. So I really do believe that the somatic work is such an important component of healing.
And it's interesting too, because it might be difficult for people to visualize, well, what is this? How do you do what you do? So if you could walk me through, what would a visit like to you be? And what is it that you're doing with our bodies while we're visiting you for a session?
Oh, so that's such a great question. So after an initial intake and evaluation, I'm going to get you on the table. This is a hands-on body work, but because it's the John Barnes method of myofascial release, it's very, very gentle. And basically, we take anyone who's trained the way I am, is we take our hands and we sink into your tissues. And then we're going to wait at that barrier. Your body is actually going to tell us how much pressure you need. So there's no prescribed amount of pressure. It's whatever your body is asking for. And we're going to sit at that barrier and we're going to wait for 5, 10, 15 minutes and allow your body to begin to release. And you can actually, you as the client will feel it, and me as the therapist will feel the tissues really begin to soften and begin to rehydrate. And it's kind of a magical experience. And so we don't use any lotion or any oil because we're not gliding around on the skin. We're actually sitting there. It's funny. I shout out to my 6 Instagram followers. They have asked me to make a video of myself working. And I say, well, if you want to watch paint dry, exactly the same thing, because I'm going to be in that one area for a minimum of 5, more like 10 or 15 minutes to allow your body to begin to heal itself. Because as I'm sure your listeners know, only we can heal ourselves.
Ultimately.
Yes.
So after you've done this procedure, the myofascial release, and what can the patient or the client expect to feel like the day after or the next day? What changes?
So I have to say, most of my clients after the session, immediately after the session, say, oh my gosh, I feel lighter. I feel more clear. If we do cranial work, which means the head, they feel like they can breathe more easily. They report better sleep. Not going to lie, sometimes people have what's called a healing crisis and they feel a little bit worse, but it's never new injury. It's what is actually already in them that is coming out. I don't want to say toxins because that's not technically correct. But we say that it's trauma that's in the body. Because this work is so gentle, it's not like we're introducing new pain. It's probably pain that was in there that is just coming up to the surface. But most of the time, people feel amazing.
Wow, that's amazing. That's amazing that people can feel the difference for that long. And here's another question for you. How long does it last, or is it forever? Or do they have to come back for, like you did with some other doctors, for adjustments, or what can they expect in terms of duration?
So that's a great question. It depends on what problem you are trying to address. If it's an acute problem or if it's something that's chronic and you've been dealing with for years. And normally, it would be irresponsible of me to say. I like to tell my clients, you know what, we're not getting married. Don't feel like we're going to be together forever. I like to get my clients in, get them to their goals, because everybody has an individual goal, and get them out on their way. Typically, I see people for 6 to 24 sessions, depending on where they're at and what their needs are. Some people have had literally miraculous results. I had one gal who had a frozen shoulder for 8 years, and we worked together one session and she got full range of motion.
Wow.
Yeah, that was pretty miraculous. It's more likely most of my other shoulder candidates that are frozen shoulder are between 9 and 20. So
Frozen shoulder is something that is very common with women over 40, especially postmenopausal, premenopausal, menopausal women. And a lot of it has to do initially with the lack of estrogen, which is so interesting because estrogen is responsible for over 300 processes in the body. And you really don't know until you begin to lose it how it can impact you. And one of those, excuse me, things is frozen shoulder. Excuse me. Get a break real quick. Okay. How many sessions does it take to experience any lasting relief?
again, it really depends on if someone is coming in for a twisted ankle and we can get a handle on that in 3 to 6 sessions, or if it's someone who had like one of my clients had a botched back surgery, and it took her 6 months to get out of her walker, and now she doesn't even walk with a cane. But she was a little bit longer because she had to recover from the surgery, and we had a lot of work to do. But
Yeah, that's a lot of trauma to the body. Anytime you have back surgery, that's a lot.
yes, and she had a lot of emotional trauma just around the surgery because it was a botched surgery. And so there's a lot of processing that had to happen with that. And so it's interesting. One of my clients most recently said to me, "Oh, so this really is trauma work. And it's, this is who's best for trauma." And I said, "No, this is for people who are in pain, in physical pain, because it is a somatic practice. And some people never have an emotional release, and that is a-okay. This is going to help you get out of physical pain. There is the added benefit that if the pain has an emotional component, that can be released as well." But I also just want to let people know, this is great for acute injuries like the twisted ankle, the sprained wrist, the busted up finger. I'm talking to my climbers out there, but also people who do suffer from sciatic, from chronic illness, from chronic pain. This works
I'm
great
glad
for
you
that.
mentioned sciatic because that's a classic symptom that a lot of my clients experienced when they were expecting. Most of my clients are past childbearing age, but they just remember what that pain was like. And interestingly enough, as they, begin their menopausal journey, some of that comes back. So it's wonderful to hear you say that you work with that kind of pain as well. Now, of course, this is a podcast that goes all around the world. But you mentioned that there's a tip that you might be able to share for people. And also, if you could tell us how people can actually connect with you and maybe other ways that they might be able to connect with your network of therapists that specialize in this particular modality.
Okay, well, most people, when they have a pain, they've been taught to press something onto it, like a ball. Most people either have a lacrosse ball or a tennis ball or a racket ball. I recommend something soft to start with. And then you've probably been told by someone, roll it around. If you have a shoulder pain, roll it up on the wall. If you have a back pain, you can roll it around on the bed. What I'm going to encourage you to do is a little bit different. You're going to find that spot, and then once you find that, and when I say what that spot is, that spot. When you find that spot, stop and allow yourself to soften onto that spot and stay engaged with that spot for a minimum of 5 minutes, preferably 6, 7, 8, and begin to feel your body relax onto your, self-treatment tool, which I'm going to just call it a tennis ball or a racket ball. Don't be rolling it around, and definitely it's not enough to engage your fascia if you only do it a minute and a half or 2 minutes. And here's the other piece: be fully present with it. Don't doom scroll. Don't talk to the dog. Don't, yell at your husband or your partner. Just fully be focused on self-care. Self-care is so important, especially for us women in middle age, because we're dealing with aging parents and we're dealing with younger kids, and we're just dealing. Let's just take some time for ourselves and love ourselves enough to self-treat for a minimum of 5 minutes.
And that's such great advice. And I love what you said about being present, because I think that's true with any kind of modality that has to do with peeling back the layers and getting to the root of something. We have to learn to be present, which is something that we are not always here in our society, especially these days. There's so many distractions, so much is going on that it's sometimes hard to be present. Do you work with your clients on that and helping them to stay with you in the moment? Is that, yeah?
Yes, 100%. That is a lot of what this work is actually is staying in the body. And so much of what we do is in our heads. And when I say we, I mean like in life. We don't take time to be present in our physical self. And so when we're working with myofascial release, I'm often inviting clients back into their body, back into how it's feeling. And that just made me think of when you're laying on, let's say, the ball for 5 minutes, and you're being present with it, note if anywhere else in your body begins to light up, because that's also letting you know that there could be a fascial restriction. So if you're working on your shoulder and all of a sudden your lower back lights up with a little tingle, or even possibly something as far away as your big toe, explore that, because that is a connection that, until you're quiet and focusing on, you're not aware of.
That is true. As you were saying that, yeah, I was a classically trained dancer, ballet, for many, many years. I stopped dancing when I was 63, and that was 5 years ago. And because I'm not moving the way I used to, I still work out, but I don't dance. I don't like dance 5 times a week and, in preparation for a performance or anything like that. And so now I'm beginning to feel the aches and pains from the years of, I'm going to say it, physical abuse, because that's what dancers, especially ballet dancers, do to their bodies. And there is this one little crick that I have in my back. And the interesting thing is that it shows up at an odd time. And until I talked with you, I never really thought about what was going on when it was showing up. And almost always when it does show up, there's been some kind of remembrance or something in regards to my mom. Now, my mom has been gone for almost 30 something years. She was hit by a fire truck on her way to work. And when she died, I had just had a baby. She was 6 weeks old. And while I was convalescing at her home before I returned home to my other two little ones and husband, I stayed with her after I had the baby for a little while. And one night the baby woke up and I wanted to pick her up and put her to the breast. And what I did was I twisted and turned, and I something weird happened with my back, and I got a crick basically in my back. And so my mom came in, and it was so painful. It was hard for me to hold the baby. So my mom, came in and helped me get my breast out to breastfeed and all that, and rubbed my back, and it worked out. Well, when thinking about this, because I don't get this crick all the time, just occasionally, maybe once a year, something like that. And now that I think about it, it's always right around the time when my mom passed. And I know that there is a connection. But first of all, that's a really great memory, because I can remember my mom getting all frustrated with me because the baby was crying because she was hungry. And I was upset with my back. And she's like, Linus, forget that. Get your boob out. She's pulling out my bra and pull my boob. I was like, Mom, please. So it was kind of a funny thing. But that feeling of that pain in that back and that crick, it lasts for a couple of days. And eventually I'm able to work it out. But now I realize it comes from remembering spending that time with her. It's really strange, but to me, everybody who's listening, this is a good example of why you need to maybe explore doing this kind of work and having this work done, because I think we all have that ache or that pain, and we don't know where it's coming from. We don't know why we have it. But what I hear Gwen saying is that it could be definitely trauma related or emotional related. Now, I know that you are in California. I'm in California too. And I know that you have made some recommendations. Tell us a little bit about how people can work with you, and also what other things you suggest they do to find out more about what it is that you do.
So I am located in Chatsworth, which is a little bit northwest of Los Angeles. And I love, working with people in person. Eventually, I am going to be developing an online class, but we'll put a pin in that for now. But I invite everyone to come to Southern California as a destination because I offer an intensive treatment where you can get 3, 4, 5 days of this work for 3 hours a day. You cannot overdo this work. And it builds on itself. So even if you're in Michigan and you've been thinking, do I want to go to Los Angeles? Yes, you do. And you want to come see me. And if it's okay with you, I'd like to offer your listeners a discount, a $500 discount, if they just say V.I.B.E Wellness when they call or come to the website, which is www.performancemfr, like myofascial release.com.
Fantastic. In fact, everybody on the show page, you will see her social media links as well as her website and the information about the $500 offer if you mention V.I.B.E Wellness. That's fantastic. What a great vacation, I would think, to go and visit you and get everything worked out and really enjoy a day at the beach without any more worries of pain, emotional pain, or physical pain. What a fantastic service you provide, Gwen.
Well, thank you so much. And for those of you that are not able to come out to Los Angeles and want to try myofascial release, there is, it's called the MFR, which stands for myofascial release directory. .com, and that will help you find someone who is trained in the John Barnes way. And then also, if you just want more information about myofascial release as a concept, it's www.myofascialrelease.com, and that is the mothership for the John Barnes myofascial release. So I love this work. Everyone deserves to feel great and feel better. Check it out. It may be for you, and it may be the missing link in your healthcare.
Definitely. That's why I love talking to holistic practitioners that basically have ideas and things that you can do that might be outside your traditional approach. But sometimes we have to kind of, dig deep to get the healing that we want. And I'm so excited about the growth in the holistic industry, and people are beginning to find other modalities and ways to heal. And here's yet another one, myofascial release that Gwen Bernardo is talking about. As I said, to find out more, the information is there in the show page. Thank you so much, Gwen, for being on the V.I.B.E Living podcast. It's been wonderful having you here today.
Well, thank you. It has been my pleasure. And I just wish the audience well. And I hope everyone feels great, because that's my goal.
Fantastic. And thank you all for listening. I love bringing to you some of the premier experts in the field of mind, body, spirit wellness and how to live holistically, especially as we age and as we go through that journey called midlife. It's all about the vibe, learning how we can be more vibrant, more intuitive, beautiful, and empowered. Thanks so much for listening. Have a fantastic day. And don't forget to vibe. Bye-bye, everybody.